Welcome to Mind Matters, the inside scoop on UK mental health services. In this podcast, we'll explore the world of mental health services in the UK, we'll cover everything about the different types of services available to the funding and accessibility to mental health services. Join us as we break down the stigma surrounding mental health, provide you with the information you need to take care of your mental well-being. I'm Rosemary Rajkumar Mangrove Norbury, and this is our first episode of My Trauma is Chronic, but I'm Iconic. And with me, I have...
I'm joining this podcast with Rosemary. I'm autistic. I also have ADHD, and I have been in care for almost 3 years. I've lived in 5 different placements, and I've been under 5 different CAMHS teams over the past 6 years. I have CPTSD along with BPD, which I'm currently in treatment for. I'm here to share my experiences in the system.
Yeah, several men as with me, and we both have lots of similarities. So we both have autism and ADHD and complex post-traumatic stress disorder. And I have depression, anxiety, and we have emotional dysregulation together as well.
Yeah, I also have anxiety and depression.
And a dissociative disorder. So we have so much in common, and we go to the same building for our sessions and stuff like that. So that's how we know each other. And we've been in care. I've been in care for a bit over 3 years, and Manners is reaching her 3rd year.
Yeah.
And we have gone through so much challenges, like from placements to accessing mental health services. And there's many other young people like us who are finding it extremely difficult to get the help that they need, which causes a knock-on effect for their mental health to deteriorate further. So what are some of the common challenges that you and other people that you've talked about face when trying to access CAMHS service?
With my personal experience, the first time that I was referred to CAMHS, I was referred to CAMHS for anxiety. My referral was rejected. I was re-referred to CAMHS when I expressed to my GP that I was experiencing suicidal thoughts, and my referral was accepted quite quickly.
Yeah, and this goes, we've talked about this before when we were doing our planning session, is that it has to be at the higher end of the spectrum for you to get seen. You need to be suicidal, actively feeling suicidal. You need to show lots of different traits for you to get accepted. So if you just say, oh, I'm anxious and I'm really having really bad anxiety, but if there's no risk factors, then they won't take in your application or referral. And how long did it take you to get your first CAMHS appointment?
A couple of months. Okay. But I suppose for me, that was because I was deemed as very high risk.
When somebody who's so high risk doesn't have the right support, it just causes them to be in a place that's extremely stuck, and people around them don't know what to do, and they don't know what to do because they're waiting months and months for care that they need right then, right now, right then. Did I say it right? I'm not sure. But and also CAMHS, tier 3 CAMHS, there's 2, one for the community and one for looked after children. And because I was a looked after child when I first got referred to CAMHS, I got seen within a week. But my referral to SLAM DPT service took way longer. It took so if it was, I think, let's say June, yeah, it took 7 months for me to just have an assessment. And then it took 8 months for me to get pre-treatment. And then another 9 months for me to start my treatment. And that was really, really, really challenging, because when the referral time is so long, a lot of things happen, and sometimes you need much more intensive care and therapy to get better. But yeah, that's challenging. How did you feel?
So my experience at the beginning, when my waiting time was quite quick. I ended up getting discharged and I had to be re-referred. And it took about 4 months to get an appointment. I could have been seen sooner, but I refused to see the same clinician, as they dismissed all of my mental health issues as behavioural issues. When I first got put into care, I had moved to Southampton when I'm from London, and Eastleigh CAMHS took about 4 months to accept my referral, because my care home had their own therapy team. They didn't want to have any involvement, as they thought I had a sufficient support put in place. They also tried to dispute some of my diagnoses. I'm not sure why. And then I moved again, and it took a while to be referred to West Berkshire CAMHS. They would only see me from medication reviews. And then I moved again, and my case was transferred quite quickly when I moved to South London. And then when I moved back to North London, I think it literally took about a week for them to transfer me over.
Again, we've talked about this before as well. It's the postcode lottery. Like in South London, I've noticed things are much more quicker.
And there are so many CAMHS teams within South London. They have so many different types of support that they can offer. I don't know if you've ever heard of, they have a tier 4 service in the community. I don't know if you've ever come across them.
AOT, Adolescent Outreach.
No.
What's the team called?
I can't remember, but they have a tier 4 service within the community. So they have support workers and RMNs and psychiatrists and psychologists that come out to your house and take you out in the community and do activities with you and stuff like that.
For me, in my experience, that sounds like I had something similar to that, and it was Adolescent Outreach team. Oh yeah, the person that worked with me, oh my gosh, she was amazing. But the thing, yeah.
But that only exists in South London, because that does not exist in North London. And it's amazing that it does exist, because it actually prevents people being sectioned or being admitted as inpatient, because you can receive the same support within the community, which I think is pretty amazing, and they should have that everywhere.
Yeah. So like I've noticed, unless you do quite serious, like all suicide attempts should be taken seriously. However, of the incident, I've noticed in South London, the severity of the incident, like if you were, trigger warning, if you were in front of a train on a level crossing, you would definitely get admitted. But if it's like, something less serious, like trying to run into a road, still serious. But run in front of a road or something like that, where there's vehicles at high speed or something, you will be referred to community service, whether it's going to be tier 3, 4, and they will try to keep you in the community, and they always use it as a last resort. Whereas in North London, if you get sectioned, there's a very, very good chance that you're going to get sectioned further.
Yeah, and that's again because of the lack of resources.
Yeah, the lack of resources needs to
It's a matter of postcode lottery.
It's, you can't blame the NHS, because it's not like they're like a privatized, some of it is, but it's like a private company. Government should really rethink about how much money they invest in there, because the last time I checked, it wasn't that much. Like,
I remember one of my admissions that I had when I was living in South London, the crisis team came to assess me, they were like, oh, you're on the waiting list for DBT. That's all the support that we can offer you. Go home and wait for them to see you. And it was a bit like, I had to wait about I think I had to wait about 10, 11 months for the DBT service to become involved. And it's ridiculous.
I do agree. It's extremely ridiculous, because what are you going to do in the meantime? Because there's so much risk. And when somebody, if somebody assesses that person, be like, whether it's a support worker, to a police officer, to paramedics, or whomever, and they decide it's in the best interest to bring that child into hospital, they believe other people, usually paramedics travel in 2 or 3s, they think that child, young person, adult, whomever, needs to be seen immediately and given the right attention and care. And people will be like, okay, you've got a referral going on, wait till then. But a lot of things can happen. Like, for example, when I was waiting for my referral, from CAMHS, tier 3 CAMHS to tier 4, I had an abusive foster carer. I was going in and out of A&E multiple times a week. Like 1 month, I was there for 1 month. I've been in and out of A&E 30 times, which is ridiculous.
That is ridiculous.
30 times. That would be sometimes 2-3 times a day, this is proof that nothing is done. I feel like if somebody attempts to kill themselves, no matter how, because they didn't do it in a very severe way, or what's seen as severe, doesn't mean it's not serious and they don't need their attention.
Even an attempt to do something severe doesn't count unless you've actually succeeded with whatever the attempt might have been. For example,
then it's too late.
For example, if you tried to jump in front of a train but you were restrained before you managed to do so, they don't really care. But if you were physically in front of a train, then they do care and they section you.
Come back to the sectioning part in a bit. Because a lot of placements, people are unaware that Parliament is trying to change that, but a lot of placements are unregulated, and a lot of placements do not use restraint.
Like my last placement, for example, was unregulated, and my local authority didn't even know that it was unregulated because they only checked on my placement manager, who sent a CQC report for a different placement within that company, not the actual placement that I was living in.
That's fraud.
And I've never been under a dole's order, but staff had restrained me on a few occasions when they're not allowed to.
Okay, what should happen is, if a young person goes into a placement which is unregulated, quality assurance or the placement team of that local authority should be doing quality assurance at least once a month, like what a regulator 44 does. And make sure they're doing their job properly.
Unregulated placement from the age of 16, you're still a child.
Yeah, and I think it's absolutely outrageous. Can I be honest with you? It's absolutely outrageous and it's absolutely outrageous. I feel like anything to do with people, human beings, I feel like it needs to be regulated. There needs to be someone outside, independent from the local authority, independent from the government, independent from the place of residence, that's going to be like, okay, this is not good enough, and they're going to do something about it. If it's not good enough, it's not good enough.
You definitely need surprise visits as well.
Yeah, definitely. They need to just show up, because that's when you can see the real raw what we go through every day. Because it's these oh my god, we're coming to do an inspection. Yeah, that shit doesn't work.
And then you can literally see up. They literally tidy up. They make everything look like very homely.
And do their display boards.
Yeah, and
love the display boards.
And then staff, they act extra nice.
Yeah. So yeah, and I think a lot of staff try to manipulate their young people, be like, oh, I'm being nice, because a lot of young people with trauma they're not all, majority of young people with trauma can easily be deceived because either their emotional intelligence or self-awareness about situations are not exactly there, which is understandable because of their experiences. We'll find, oh, they're being nice to me, so I shouldn't say this, because they're like, oh, this person's being nice to me. If I say that, it might jeopardize our relationship.
Or they will they'll pretend to be nice in front of these people, and the moment that you get a bit annoyed at them because they don't usually behave this way, they try and make out like you're the problem.
Yeah, definitely. I've never had that experience, but other young people that I've talked to do have that experience. But like, coming back to the point is, like, you know what, the NHS does not have enough funding for decreasing waiting times, getting new psychologists, new psychiatrists, or more.
Yeah, like to my knowledge, the law within London, if you're under 18 and you present, or maybe even if you're an adult, if you present to A&E for a mental health crisis, you have to be assessed by the mental health team before you can be discharged. That has to be done. Whereas when I first got put into care and I was moved out of London in Southampton and Reading, they don't have to assess you. They can discharge you without you being assessed by CAMHS or by a crisis team for your mental health.
Yeah.
The NHS, I don't understand why it isn't the same in every single place within the UK. It's in the same, it doesn't make any sense.
Yeah,
why is the care different?
I think the rules and regulations should be the same. The standard of care should be the same. Especially with also Metropolitan Police and British Transport Police. The attention to everything, every single detail, every single policy should be exactly the same. I do not understand why this is making me so angry that I can't get my words out. You discharge a young person without CAMHS getting to see them. This has happened to me on multiple occasions, and this has caused so much incidents and much more A&E visits.
I have also found that because I've like my first two care placements were two therapeutic children's homes, and because they're therapeutic children's homes, hospitals, they assume that the care home have enough facilities and they can facilitate enough care for the young person to not need any output from a CAMHS team or a crisis team. And it makes no sense because you're discharging a patient home and you don't actually know what care they're going to receive when they go home.
You know what? Right now, I'm rolling my eyes because of the word therapeutic. The word therapeutic, let me be honest with you, therapeutic means absolutely nothing. It's just a word that people like to put in front of, like, when they like as an adjective to describe their care home, make it seem good to social services, make it seem good to other people and people
my current care home that I'm living in is not a therapeutic care home, and when I tell you, it feels way more therapeutic than all of my therapeutic care homes that I have been in. It makes no sense whatsoever. Why is a non-therapeutic standard care home better than therapeutic care homes? It makes no sense.
This is one thing that I find really, really frustrating, is that people don't realize or they don't know why what a patient's like, and they're like, oh, we've just read about it, and okay,
or
it seems
they
great,
speak to and carers. They don't even bother speaking to the patient or the young person. If they have carers with them, they will approach and speak to the carers first behind the patient's back.
Yeah.
They've got special training to deal with ASD patients, especially with children, and they don't.
I can name you wards like at the back, on the back of my hand.
Even like some of my care homes, they like to say they've got like adequate training in ASD and stuff, and mental health conditions. When they don't.
Yes, actually, and I'll be honest with you, one of the things that I find really, really, really difficult to understand is people don't understand how easy the training is. It's not about like they've put these tests, you need to get 4 out of 4, stuff like that. Staff members help each other staff members to do.
Yeah, we've both had the experience where they actually take pictures of their training and then answer their questions looking at the pictures that they took.
Yeah, and I'm like, you're not really learning. I feel like it should be an in-person course, and for the instructor to gauge whether
not be a way to cheat. They should not be allowed to cheat.
Where this person can say, yes, this person does have the correct knowledge and understanding. But a lot of placements, they click the right buttons, click the right choices, submit it within the time, and they get a certificate. It's very easy to do. I've seen members of staff doing that, and it's very easy to do. And these are all the things that we're talking about, like them using what's it called? What repeated placements are amazing, and they're what the children need, the therapy support and stuff like that. And or they're able to use restraint. They have MAPA training, so if something dangerous or risky happens, that it can be fixed. It can be fixed. I've heard that term used before. It can be fixed. They will get better with time in that placement. No, it doesn't work like that. Mental health is a real problem. It doesn't matter where you are. You could be in the most loving, caring environment, maybe even a family environment, because this is what, as Maslow's theory says, this is what we need, like, to be with our primary caregivers, whoever it is, with love and care and stuff like that. But if you have mental health difficulties, things are still going to be the same, because love and care only goes so far. And if we don't get seen immediately, or if people don't respond to us with the right attention and care and sourcing the right sort of interventions for us, it becomes really difficult. And you know what's really frustrating? The NHS doesn't have enough funding. The NHS is not privatized. The government doesn't give them enough money.
People were dying every day.
Absolutely. And it really is not enough, because you need specialized training to work with people with ASD, with complex needs, or with complex post-traumatic stress disorder. People need to realize to be really mindful about how they approach and work with a young person. And this cannot be done without the funding that the NHS needs.
One of my support workers at my placement is actually a learning disability nurse in Hertfordshire, in a hospital in Hertfordshire. And their policy is amazing. Like with autistic patients and stuff, they plan, if they have an appointment or if they know that someone's going to be admitted, they have everything done in a structured way. And like there is no waiting time. A doctor will see them immediately. And like they have a whole procedure put into place for patients with a learning disability or autism. And I don't understand why they don't have that in every single hospital. Why is it only one county has this specific procedure put in place that is actually helping? And also there are actually many patients that go to hospital that are on the spectrum, because
that's very true.
Many people with autism have comorbidities and a lot of health problems.
I agree with you. And like, it's very hard to find, but because we're like in mental health services and inpatient wards and stuff like that, is much more easier, because people with autism are very likely to have mental health difficulties. But it's very hard to find. But there's so many autistic people, we just don't know, because it's not like it's tattooed on our forehead, autistic. So you don't have to go tell someone that they're autistic to get them treated properly.
Yeah.
Because it's like a job. If you apply for a job, and you don't have to say you're autistic before, during, or after the interview. But you should approach everyone the same way. So,
for example, in this hospital that this staff member of mine works in, for patients, like autistic patients that don't like being touched and they need to take observations and stuff, they actually have like a patch, like a bit like a plaster, and they just scan it and it will show them like their observations, like their blood pressure and their heart rate and their body temperature and all of that, so they don't even need to touch them. I don't understand why there's not more funding in other areas of the UK where these things exist as well.
According to British Medical Association, on the 6th of April 2023, which was 2 months and 2 days ago. Love the numbers. Sorry. Health spendings has increased significantly over the decades since the NHS has been established in 1948. Health spendings in the UK reached 220 billion in 2020 to 2021, and this is excluding the extra 47 billion pounds for ring-fence COVID funding. That's okay. The number may look so big, but there's millions of people in the UK.
Where is it going?
They're cutting back on the money. That's the government's plans. They want to cut back on the money for people with additional needs or people who are vulnerable. And then Sir Mark Rowley makes an announcement, the Commissioner of Police, saying that they don't respond to mental health calls unless it's life or death. Like, what? Who the hell came to the table and be like, "Good morning, people. This is what we're going to do. This is why we should do it." We don't even know why they want. No, actually, we actually do know why.
Do you know what's going to happen? Paramedics are going to have to deal with the cases that the police won't take on. It's going to be someone else that's going to have to deal with it, and it's most likely going to be paramedics.
Yeah, and soon to be implemented rule is detrimental to other people's well-being. I saw why what the police commissioner of the police, Sir Mark Rowley, he said they want to cut back on spending time on mental health calls and focus on crime and victims of crime. Majority of people who have mental health difficulties, majority of them have post-traumatic stress disorder or complex post-traumatic stress disorder. Those people have been victims of crime that more than once in their life.
It shouldn't be police that have to deal with mental health patients. They need mental health professionals to be able to deal with mental health patients.
Again, we don't have the money in the budget. And I'm sure Rishi Sunak or the next Prime Minister, I'm sure none of them are going to give us the money that we need. It's absolutely disgusting that they're going to stop responding to mental health calls.
Which is literally the number one cause of deaths in the UK.
Absolutely. And why you're going to assess life and death? Like, when somebody's having a mental health difficulties,
it can escalate so quickly.
Exactly. Escalate so quickly where it's absolutely...
It's like when you call them and they say, call us back if anything changes, if anything gets worse. And by the time that you're calling up again, there is a proper emergency going on.
Yeah, and then you don't respond in time.
Yeah, and it's too late.
And you're like, well, there's nothing we could do about it. This is going to cause so many issues. Number one, people are not going to get the help that they need because police are not going to be responding to mental health calls, right? That's number one. Number two, the police and the members of the public already have a bridge, right? They already have a bridge between them and us. And they're just creating a longer, bigger bridge. And it's causing more trust issues with the police. And when there's crimes or real life emergencies happening, they're going to be hesitant to be calling the police or any emergency services. As a public, understand the cause and effect of making a 999 call. Majority of them do have the mental capacity to understand the cause and effect, right? And if they are trusting you, the people that are emergency responders, to take their words seriously, understand the risks involved, and sometimes that can lead us to react in a fight mode, which is aggression. And, the police can help either de-escalate aggression or, most appropriate, force to keep both the individual at risk and other people safe.
Do you know what I don't understand? Why do police treat people like why do police treat mental health patients the same as criminals. That I just do not
Yes,
understand.
I don't understand that either. It's like police are deemed to be the most appropriate people who have little to none training around mental health, and they're given the power, not the paramedics, let me remind you that, not the paramedics, but they're given the police the power to deem someone not to have mental capacity and trust the police to be like, okay, we've responded to this emergency and we deem this person, the individual at risk, not to have any capacity. Not the paramedics who
they don't have patience
trained.
either, because they have victims of crime to be like dealing with and to go to. They like doing whatever they can to get out of the situation, even if that means like being aggressive towards a mental health patient and restricting them. But when they can do that without, or like they handcuff you for no reason, they can maintain restraining you without having to handcuff you, but sometimes they just choose to handcuff you anyway.
Or they do inappropriate forces using your neck, holding you like down with your neck. But I'm like, stop treating us like criminals, right?
Yeah, literally.
We are not criminals, and people, especially
criminals are treated better than mental health patients.
You know what? I can't even say like you're lying. I can't even say that.
You know how they handcuff them at the front? With me, whenever I've been handcuffed with my hands behind my back. Even when I've been arrested, I've been handcuffed with my hands at the front and at the back. But like, for my mental health and whatever, they literally fully just restrain me with my hands behind my back. There is just no need for that.
Vendetta. I don't understand who in the world. What were we talking about? Police. They treat us like criminals, especially the people with a bit of melanin, people of color, and it's disgusting. And police officers, I've noticed, when people are part of the BAME community, they are treated with a lot more aggression. And then when somebody is distressed, there's 5 states that they can get into: fight, flight, freeze, fawn, flop. And they can fight back. They can sense the threat because the police are being so aggressive. They can sense it either by the tone or by the body language or whatever it is. That part doesn't matter. And they will respond with the same level of aggression, or maybe even more, because of the way that the police are reacting, or the paramedics are reacting. If you treat us with a calm, clear mind, and you are able to reflect that in your actions, trust me, a lot of things could be prevented. A lot of aggression could be prevented.
Some police officers, I feel like I can't trust police.
Yeah.
And I feel like they're all going to be racist towards me just because I've had experiences where some of them have been racist towards me.
Yeah, and I've noticed that people are like, especially when you go to A&E, for like, when you there's no space in the 136 suite or anything.
Yeah.
And they just be like, and they're just going to be like, oh, she's here again. But to other people who are not part of the BAME community do not get treated the same as us.
Yeah,
they're not really culturally sensitive either.
It's very hurtful. That is very, very hurtful, witnessing how, knowing how you're treated when you're literally not doing anything compared to a white person. They're doing so much worse than you, that they're being way more aggressive than you were. So like, say a person of color kicked a police officer once, they're going to be like restraining you to the floor. Say a white person is spitting at them and doing this and doing that, they're not going to do that to them.
But I also have to, I also have to clarify as well. They are, let me rephrase. There's some good police officers. There are amazing.
But another thing that I have found, if you have one racist police officer, the other one doesn't really, they just play along with the other one. Like, I've definitely seen like a power struggle and the other police officer doesn't know what to do and they just follow the other police officer's lead. And that is also very fucked up.
Yeah, it really is. Yeah, people of color are more likely to be criminalized because of our skin color. And it's not fair and should not be happening. And anybody with mental health should not be treated like a criminal. They are actually in physical, emotional, mental distress that they cannot control what they're doing. They cannot control what they're saying. They cannot control their actions. And you know what? Police officers, they show up to the scene or where you are, and your staff members will be there as well. And they would act as if the staff members don't have to endure it every single day. There's so many lovely people, support workers, healthcare assistants, all sorts of people who are in the public health sector, health and social care sector, who go above and beyond and know how to deal with our patterns and behaviors and our trauma, which we're very grateful for. And police officers show up and they're like, why is... They react with instant aggression, and that's not the solution. And police officers, there's some really, really good police officers, but those really, really bad ones just ruin the bunch. Like Mena said.
My speak. You know how paramedics make the decision of, like, if you don't have mental capacity, but then they can't restrain you. They have to call the police to come and restrain you.
Yeah, and I don't think...
And then police, they show up. They don't even ask what's going on. They're like, oh, we've been called here and we've been told you don't have mental capacity, so we've come to restrain you. We don't care about what the story behind this is and why it's happened. We've come here to restrain you. We've been told that that's what we're doing. And they don't even question why they're doing it. They just do it without even knowing the story behind it.
Like, if they're going to treat us as criminals, either way is still the law, whether you're a criminal or not. The least amount of force must be used. And you must know, they can restrain you whilst getting hand over, right? But they need to know why they're restraining. They need to know if the restraint is appropriate. And they need to use the restraint for the most appropriate amount of time and the most appropriate and minimal amount of time.
And if all of that was put in place, they wouldn't be able to abuse their powers.
Yeah, but like, it's the same with the young person, because they think...
Have you had it where police turn their cameras off when they're restraining you?
Yeah. Why are you turning your camera off? Why are you turning your camera off? Because you know you're doing something wrong. But like in an inpatient or outpatient setting, or even in the community, I've noticed that BAME people are treated much worse than our white counterparts. And the reaction of the same action is different. The reaction for people who are BAME is over the top, dramatic, unnecessary use of force. But does it matter? No. To them, it doesn't matter. But it should matter, because we shouldn't be treated like criminals because of the melanin in our skin, or the way that we look, or what sort of hair texture we have. I've noticed that's a big thing. Or anything like that. So how do cultural attitudes towards mental health impact British Asian women, do you think, from your experience?
There are so many things we could like talk about and say. Like, there's so much. I would definitely say like people of color, especially women, we're definitely seen as dramatic.
Yeah, or we're seen as loud and boisterous and like
if we were to talk about our problems, people would think that we're exaggerating when we're not.
We're not. And it's really frustrating because you're not taken seriously. And people, again, this comes back to race. People see our race and be like, oh, she'll be able to deal with it better. She'll be a bit more resilient. No, unlike everybody else, I may be more resilient. I may not be, whatever it may be. But you should treat me like every other patient. You should treat me with an open mind, like you do to many other young people.
Yeah, like white patients get such, like, the quality of their care is so much better than compared to people of color.
Yeah. And I've noticed that as well. And I think we face so much additional barriers to accessing mental health care due to language barriers, cultural differences, and lack of representation in the mental health field. We don't see Asian nurses, Asian healthcare assistants, or Asian doctors that often.
Especially like being autistic and being, like, two young women of color, the way that we're viewed.
It's disgusting. It's absolutely disgusting. And one thing that I've noticed is, even if we go to the inpatient, right? The food, it's not. They do not meet our cultural needs when it comes to food, prayer times, and how they view us. I've heard a member of staff in a psychiatric ward. There was this guy in there. He was around 15 years old. He had a very thick beard, and he had like curly hair, and he looked South Asian. He's Pakistani. And a member of staff saw his name and said, "It sounds like a terrorist name." He has a very traditional name. And I'm like, that was so wrong in so many fucking different ways. It's outrageous. It's absolutely outrageous. Number one, that was a religious name. Number two, you do not say that to anyone. This is because people are not exposed to people like us. In the healthcare field, there is not many people. There's not even a few people. They're like maybe a bit less than 3% of people that look British Asian. We can't talk for any other ethnicities because we're not any other ethnicities.
Yeah, of course.
But no, it's not like that. And like some of the things is they don't understand your cultural background. They say, like, if you got food from your parents or something, they will make comments.
They say they'll meet your cultural needs, but they don't.
Like many placements. But like, yeah. And if we feel more comfortable with talking with the female staff, they scoff. And then they go, okay, and then we have to wait a much longer time. Even just finding a female staff member, acculturation and immigration and discrimination are one of the few things that women in the British Asian community who have access to mental health services experience, or who do not have that access but have gone through assessments or A&E visits and have felt that. And a lot of the community-based interventions, such as peer support groups and culturally tailored mental health programs, will be more effective in addressing mental health needs among British Asian women. If I see a poster, right, and I see, oh my God, the woman is British Asian, I'm going. Would you go? I'll be like, okay, I'm going to rearrange my whole schedule for the week so I can attend 1 hour of this day.
Yeah, definitely. Like, okay, like an example that I have is, for example, some of the emotional abuse in my language, if it was translated to English, it doesn't make sense. You wouldn't understand why how it would come across as abusive. You wouldn't understand it at all. And I feel like when it comes to having therapy and stuff as a person of color, and, all of these cultural aspects that have influenced my life and the abuse that I've been through and all of that kind of stuff, they don't understand. And like, even with social workers, when, like, before I got put into care, when I try and explain to them, this was happening, this was being said, they're just looking at me like they don't understand. They think that I'm just making this up.
Yeah, and it doesn't sound like, for example, do you, okay, a Tamil word, but South Asian languages sometimes are quite similar. What do you call a dog?
Kutta.
right? If somebody calls you that in Bengali,
An insult in Bengali would be calling someone a dog's child.
yeah. But in English, dog's child, it doesn't sound the same.
Yeah,
And
it doesn't really make sense to how that can be offensive or an insult or abusive.
yeah, and people don't understand the severity because of the language barrier. Again, we're coming back to the same stuff. Language barrier, a cultural barrier that shouldn't even have to be there. We've already have so much barriers by being female. Then you have more barriers because you're British Asian. Then you have more barriers because you're autistic. And then you have more barriers because you have ADHD. Then you have more barriers because you have trauma.
Yeah.
And there's nobody that looks like us. I've never met anyone that looks like me and that that I could tell these experiences too. However, unlike many, I'm fortunate because I've had a wonderful network of people who are really understanding and really, really considerate. But the thing is, it's just and a lack of representation is a reason why the NHS is becoming inaccessible. And to find even a female doctor for you to speak to or something like that, it will take weeks and weeks and weeks.
This is so random, but on the NHS website for like physical like health problems, for example, like having a rash, it's literally all like white babies and white people, and you have like the one picture of like a black child, but then like
wait, you found a picture of a black child
on the NHS website. But then they don't have
for me to go to be like, Mena, send me the link. That's how rare it is.
But then they don't have a brown child, and obviously, like I know that there's been black men that have been shot before, and they didn't notice until after they were dead that they had that wound because it looks different within our skin color, and just stuff like that. It's people don't know what they're doing. The lack of awareness.
And you know what? That needs to change. That's one of the things that needs to change. So
people should be trained to know what every single health condition looks like in people with different skin colors.
Valid point, but that would be very hard to do. But be aware that it may look differently and may present differently. But people I notice, like if I'm a white female presenting with exactly the same conditions as me, I'll be treated much more seriously than mine. Because you know what? They think, okay, I've had a social worker say this to me. It happens. Like they've literally said to me, it happens. Like because of how like ethnic households can be, they're like, oh, it's gonna it's normal. This is the way that it is, and this is the way that you have to be. And like, I'm like, you are in a position of authority to prevent all these things happening, but you're saying it's okay because of my skin color. My skin color does not mean that I have to go through abuse. My skin color doesn't mean that I should not be able to access mental health services.
It shouldn't mean. You mean it shouldn't mean.
Oh yeah, it shouldn't mean. Sorry. Shouldn't mean. Or my skin color should not be a barrier. Nobody's skin color should be a barrier. And if we have people like us running community-based interventions or even inpatient-based interventions, this can make it so much more accessible and culturally appropriate than traditional mental health care. And this will definitely reduce the stigma and promote social support amongst us. Even if when we go to therapy, right? Or like group therapies. I went to group therapy, there was nobody that looked like me. In your DBT group therapy, is there anybody that looks like you?
No.
That is absolutely ridiculous. And also, it's not like your GPT service's fault, because there are other young people who look like us who need to be seen but are not seen because of their skin color. Isn't that great?
Mhm. Mhm.
And therefore they do not receive their appropriate support. But a
Example,
majority,
in my DBT program, there's a support group for parents. Now, my parents require an interpreter. They have not been able to resource or find an interpreter to be able to, for them to be able to attend those sessions.
another ethnic thing is, again, the language barrier. Okay, so your parents do not speak English, or they do not speak English fluently or understand it fluently. That is not their fault. That is not whether they have learning difficulties or neurodiversity or any conditions that enables them not to understand understand the context that's been explained in those sessions. So basically, you're talking about making these trainings more accessible to parents, but a parent of this child, I don't know why I just said it like that.
Like, I've never met anybody else that has the same problem, that their parents require an interpreter and they haven't been able to put it in place. I've never met anyone in the situation that I'm in. And I also feel like I might not have ended up in care if these situations didn't occur.
Yeah, I think language, like an interpreter, is very important. It's fucking ridiculous. And Menas, how do your parents feel about this?
So you know how you have to, when you're in court proceedings, you have to have a guardian.
Yeah.
So my mum was diagnosed with a mild learning disability, and my guardian turned around and said to the judge that because she has these learning difficulties, there is no point of even providing my parents with any support or training to learn like more skills to be able to know how to parent me and that kind of stuff. Like,
and what did the judge say?
The judge basically agreed with some of it. Like, my guardian said there's no point because they're not going to understand anyways. Like,
that's why you have an interpreter. That's why you have an interpreter. Sorry, this is just making me angry. That's why there's an interpreter. That's why there's access to services like this, because there's an interpreter. There's a reason why there's interpreters. There's a reason why there's people.
And then, like, my mum, she has a bad memory, so my guardian was like, "Well, she's not going to remember anything anyways, so there's no point."
So, okay. Let me ask you this question: does your mother cook every day?
In court.
Does your mother remember to cook every day?
Yeah.
Does your mother remember to shower or brush her teeth?
Yeah.
Does your mother remember to put her shoes out before she goes outside?
Yeah.
Does she remember who you are and your family?
Yeah.
So, yeah, there might be a memory issue, but don't we all have it? I have an amazing memory.
It's literally discrimination.
It's just fucking ridiculous. Yeah, your mother, and also this is another thing, right? Because somebody has a learning difficulty, it doesn't diminish their capabilities to fulfill a role.
I don't know why people think that someone with a learning disability is dumb. I don't know why people have this perception that, oh, if you have a learning disability, you must be dumb and you must not understand anything and you must be stupid. I don't know why the world has this kind of perspective.
Albert Einstein, he has autism. He invented E equals MC squared. And everybody who's even by like who's gone to primary school or something knows E equals MC squared. He has autism. This dumb person has autism. But this person has books out. This person has paperwork out. This person is one of the most smartest, well-known person.
People also have this other perception with autism. Either you're extremely intelligent or you're really dumb and you know nothing.
Yeah, people do get surprised by that. And they expect us, when police officers expect me not to be going to school, but like when I get sectioned and stuff, when I start coming down and becoming voice me again, like they like, oh my God, you're really intelligent. Oh my God, you know the system. Oh my God, you can do this. Oh my God, you go to school, you have your qualifications. Yeah, yes, I do. Because my mental health does not diminish my capabilities. And your mother's, I don't know, it's like Menez's mother does not have the capacity because she doesn't have learning difficulties. That statement that people make, oh, because Menez's mother doesn't have capacity to look after Menez because she has learning difficulties. There are people with Down syndrome and they have, that's a new.
Oh, by the way, if people don't know what a guardian is, it's someone that stands up for the local authority in court and fights a case for why a child should be put into care most of the time.
Correction. A guardian is someone who's independent from the court and the court, social services, and the young person who advises the judge to make the best decision in the child's best interest.
This is a nursery. So I was mute for the whole school year because I definitely have selective mutism, which is not something I'm diagnosed with, but that's definitely what I have. And my nursery and all of my nursery teachers just told my parents, they wrote it in a report and told my parents, like, they believe it's just because I'm bilingual and I probably just don't understand English, and that's probably the reason why I don't speak. And it was dismissed and brushed off as just that.
Yeah, that's a really good thing to say. And I think that's like really important. They assume because of your skin color.
Yeah, because I could speak English. I would speak English at home. I wouldn't speak a word in school. But as soon as I go home, I'm speaking Bengali, I'm speaking English, and and they just don't care.
And also, things don't, in education system, things don't flag up the same way if you're a person of color. For example, every time in this DT room, the bell was right behind me where I sat, and the bell's right there. Usually it's in the corridor somewhere, so the sound is quite muted. I used to scream every single time in DT because of the alarm. That should have been flagged up. But again, because of my skin color, people saw me as dramatic or one way or the other. And I'm just like, no, stop. So it's really, really frustrating. So one of the most common mental health conditions that British Asian women suffer with is depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, so OCD, and eating disorders. So between us, we have majority of these common conditions. And what was your experience trying to find help? What did you experience when you were when you were looking for treatment, and whilst you were doing treatment, and how you got treated as a British Asian woman experiencing post-traumatic stress disorder, depression, anxiety, and an eating disorder?
I only got diagnosed with anxiety and depression after being admitted to hospital for suicide attempts. So I had to have those things happen before I was able to get those things diagnosed. And then when I was inpatient, I was also diagnosed with an anxiety and depressive disorder. And then I was later diagnosed with complex PTSD, but I don't know why my CAMHS team actually hid this diagnosis from everyone, and it came out in my EHCP a year later. And I actually called up my psychiatrist that gave me that diagnosis, and I asked him, why did you not tell me that I have this and this is what I've been struggling with? And he said, oh, we just didn't want to give you any more labels. And it's like, you diagnosed me with it. You did give me the label. Yes, you didn't tell anyone about it, but you gave me the label. And I don't understand why you would withhold information about a diagnosis.
That could be really beneficial, and then you could have looked at different treatments that could have potentially worked with and understand yourself better. Like, for example, when I found out that I was getting an assessment for autism, I looked at so many different things, right, about autism. I'm like, oh my god, finally it makes sense. All these traits and stuff make fucking sense. And it's like there's so many diagnoses, and they write it on your notes. They write it on your if you're in a hospital, they write it on your, what's it called, that meeting again? Oh, in inpatient.
Yeah.
And when you have those meetings like every few months.
A CPA.
A CPA, a care progressive approach. That's it. Yeah. I'm a bit more enthusiastic than I was yesterday. I was so tired yesterday. Anyway, yeah. So that, like, they would say all these diagnoses, but it doesn't get transferred every single time. And like, for example, I'm diagnosed with a long-term attachment disorder, depression, anxiety, emotional dysregulation, a dissociative disorder, complex post-traumatic stress disorder, emotional dysregulation, autism, ADHD. And yeah, and not all of them gets transferred through. And also, like, one of the things that British Asian women, because we're British Asian, but like ethnic people go through, is that people also hesitant to give us diagnosis because of stigma. And like, for example, in the ward, the psychiatrist looked at me and she said, you have a dissociative or identity disorder. And I'm like, okay, are you going to diagnose me with it? She's like, no, because you're going to suffer with stigma. It's going to be hard for you to find a job and stuff like that. No, it is not. And even if it is, it's breaking the law. If somebody refuses to give me a job because of my mental health or because of any disabilities, they are breaking Equality Act 2010.
It's the same thing with my DBT team. When I first got assessed and I asked for a diagnosis, they said that they can give me a diagnosis after I finish treatment if that's still what I want. And the reason why they don't want to give it to me is because they don't want me to face the stigma with the diagnosis. But I still have faced the stigma without the diagnosis because I have the condition.
Yeah, and also when I was at, like, people would like see like autistic behavior as behavioral issues. And it's not behavioral issues. It's just your brain is wired differently from your neurotypical counterparts. And it's harder for you to process things that other people might find it easier to process. And it's absolutely frustrating. Give me the diagnosis. If you think I have it and I meet the requirements for the diagnosis, give me the diagnosis. And like, for example, like we both went like on DBT teams. It's like personality disorders. After a certain age, your age stops, playing a part. I feel like after the age of 14, it stops playing the part. So then like people don't, because there's so many like people that get diagnosed with like borderline personality disorder, or now what's called emotionally unstable personality disorder.
In the UK.
In the UK, either privately or by their CAMHS or Tier 4 services, but they don't give the diagnosis because you're under 18 and they can't. But after a certain age, age does not become a factor, because I feel like after your formative years, you've already developed your personality, you've already developed your understanding of the world and how you view the world. You already are sort of complete. I know your brain doesn't start developing until you're 25, but majority of your ways or your environmental factors, as well as your, nature, nurture, all that stuff, is already played an impact and has already molded who you are. And I think that's called schemas, where the experiences that you've gone through impacts the way that you see and view the world. So, and it's just really, really fascinating how people think it's going to be a face stigma, but I don't want to be accused of doing X, Y, and Z because it's behavioral. No, if there's an actual reason why I find it difficult to, I don't know, let's keep it with autism. It's very easy to keep it with autism, like noise things, and I start getting stressed, start getting aggressive, start being aggressive towards myself or other people. It's not behavioral. I'm finding it difficult to process my sensory difficulties.
I don't understand, like, even having a diagnosis doesn't make a difference. It's still seen as behavioral issues.
Yeah, and I'm like, for example, if any members of staff who work with me say that I have behavioral issues, I'm like, no, I don't. Number one. Number two, do not come to me and say that I have that, or say that to other people because it's inaccurate. Number two, you don't have the qualifications or the education or experience to say that. My psychiatrist believe that I do not have a behavioral issues. And that's been consistent through the very beginning. So you, who hasn't gone through like years of university and years of experience working with young people like us, shut up.
After I got an autism and ADHD diagnosis, they tried to dismiss all of my mental health issues as behavioral issues, which makes no sense to me whatsoever, because autistic people are more likely to have mental health issues in the first place.
Yeah, and the thing is, right, I feel like even if I haven't gone through trauma, right, I feel like I will still have mental health issues because I feel like, for example, like, you know what, okay, this is getting very real, but like, I actually, like, when I get overwhelmed with noise, when I find it hard to navigate social situations, I become extremely suicidal because I'm like, why is my brain not like everybody else's? Why is everybody else can go to the festivals, they can go do whatever they want, they can go on with their life without the difficulties that I go through or my peers go through?
I feel like being autistic is one of the loneliest feelings in the world.
Yeah, I think the neurodiversity is like, if you want to rephrase it, is, do you want to be lonely? This is I really do. I agree with you. It's one of the most loneliest, most depressing thing. And you know what? If I have a child in this world, right, I would love and care for them no matter what. But I would really, 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 really hope that they don't have autism. But if they do, that's fine. But I really hope that they don't have it, because the pain.
This world makes you suffer.
The world makes you suffer. You're seen as different. You're seen as weird, strange. People make judgments on you on a daily basis. People that don't even know you, people on the streets, and you feel alone and isolating. And because we've been to psychiatric wards and stuff, we've been with other autistic people. But when we go back into the community, we're rarely around other autistic people. Like we said yesterday, by the way, we've run this in 2 parts. Autism is not like tattooed on your forehead. And I hope my child, I know it's hereditary, but I hope my child doesn't, like, there's a chance that my child might get it, like autism, but I really hope they don't, because I'm like, the pain is so unbearable. And even when you're surrounded by autistic people, there's other people around, like, for example, your members of staff and stuff like that. They're not autistic.
Quite often when I'm feeling suicidal, and it's to do with an autism like related thing, like, say that I just feel very different from everybody else, and I can see everyone can do things that I can't do. I don't feel like I can reach out to my friends or to my therapist, because they're not autistic and they don't understand what it feels like.
Yeah. And you know the Michael Ross Centre, the one we go to?
Yeah.
There's a national autistic team, right, in there. But like, I saw this with my therapist and stuff like that. But I'm like, who's the person at the very top, or these people that work at the autistic, in the autism team? How many of them have autism? How many of them has some form of autism? Because I'm pretty sure the head of that department is not autistic. I'm not pretty, like, I'm quite confident, because you know why? Because we are denying those opportunities where they would find, we go to a job interview, they will find us, like, they'll find a problem with us that is not related to autism, because they can't say it is your autism because of equality and all. So they'll find something else. And that's why there's not people like us in this, like, field. For example, I know this person who has an eating disorder, but they're trained as a nurse, and they have an NG tube that they have to wear all the time. And after 20 interviews, they got in. And they all give different reasons why they can't. She's graduated with honors. She got one of the best marks in her class, but yet the one thing that she struggles with is the reason why she can't. And that should not be the case. Like, you know what? I went for a job interview, right? And I said to them at the very end, I know I'm on a 3-to-1. I know I'm autistic. I know I have ADHD. I know I have complex needs. I know I have complex post-traumatic stress disorder. But that does not diminish my capabilities of my role. If I did not tell you any of this, you wouldn't know. From looking at me on the way that I present to you in this interview, you would not know that I'm autistic. You know what, Menaz? I don't even know if I'm going to keep this part in, what I'm going to say now. But, like, the world is tough on us.
It really is.
I feel like I'm going to cry, but, like, it's so hard. It's so mentally draining. I wake up every day and I'm like, why do I have a brain like this? I don't want a brain like this. I feel like my autism is my biggest flaw. That's the first thing that people see when they see, oh, this girl acts like this, she's autistic. People can tell, even if they can't.
Rachel, she used the phrase that people can smell the vulnerability. And it's like, if I had someone tell me that when I was younger, so I could be like aware that people don't have my best interests at heart and they're targeting me, that could have saved me from so many situations. To only hear this now in my life, to be told, yeah, people can smell the vulnerability. I wish I was told that when I was younger, because I never noticed it until recently, where I'm like, why do I end up in the same situations? Why do people pick on me? And it's because I am vulnerable. Being autistic does make me vulnerable.
And you know what, Menaz? I say to everyone, you know, when I see that vulnerable label, I'd be like, I'm not vulnerable, I'm not vulnerable, I'm not vulnerable, I'm not vulnerable. But you know what? I am.
Yeah,
I have to come to terms with it. I am vulnerable. I want to be treated like everybody else, but I can't be treated like everybody else, because if you want to say something, I'm going to take it literally. You're going to say something, I'm going to say something, and it's going to offend you because it's rude, it's unacceptable to say.
Because it's blunt.
It's blunt, but I can't see that. I can't see something like that. If a stranger asks me to do something, like I've been, and even the word victim, a lot of autistic people are labeled as victims. And you know what? People think of victims as big, like, crimes and violations of law. But it's from, like, you know, getting bullied at school because you're nonverbal, to people in the streets giving you disgusting looks.
Like, I feel like I'm forever going to have depression. I feel like that just comes with being autistic. Living in this world is so depressing. Like, you can find so many reasons to be depressed, because there are so many reasons. Our lives are harder than everybody else's. We have to try so much harder than the average person.
I feel like neurodiversity, that people with neurodiversity, I feel like there are like so many of us who find it difficult.
Even like autism ADHD combination, like no offense, yeah, but I feel like people that only have autism, people that only have ADHD have it so much easier than people that have both, because it's a constant fight between the two of them.
Yeah, definitely. Yeah. Like I can definitely see where you're coming from. That is like, for example, my autism likes familiarity, the structure, routine. However, I can't stay in the same room. If I work in this room in one day, I need to be in another room the next day, another room the day after, another room, you know, or like, and it's just like really frustrating. It's really hard. And the thing is like, and there's nothing I can say or do that will make it comforting. It's like what I find really, really like upsetting is when I like show signs that I'm struggling with a noise or something, and people say, "Where are your noise defenders?" That makes me really upset. Does it make you upset?
People like to tell me to go to a quiet place or something.
No, I don't want to. I don't like. It's the thing is, I have to adapt to the world. It feels like I have to adapt to the world. The world never adapts to me. I feel like with neurodiversity, the world doesn't adapt to us. It's made for neurotypical people. Everything is made for the majority. The minority are forgotten.
100%. In my college, I struggle with noise a lot, and I've been complaining that the classrooms are always too noisy for me to do my work. And recently, my college turned around and said, "Yeah, it's just you. You have the problem. It's not the environment."
Yeah, I know that it's just me that I'm autistic. You should have read my EHCP file before you accepted me. Sorry,
I never thought about it like that. I genuinely thought like it was just very noisy. But then them telling me it's a me problem was literally like, whoa, like thanks. I felt like a lot of shame, because it's not something I can help. Like, you know, it's not something I have awareness over. And the way that they just pointed it out, like, yeah, you're the one with the problem, and we're right, you're wrong.
Shut up. You know what? And then the thing is, and when you've, I'm not going to say exactly what we were talking about, but you know, when you called me upset that day when I was on the way to the job interview?
Yeah.
You know what? And you were like talking about how autism is difficult and the people around you having lack of understanding. I experienced this, similar things. And the thing is, I couldn't be like, it's going to get better. I didn't say that. Because we both have autism and ADHD. So I understand that, you know what? This might be like this for the rest of our lives. You know what? The only way we're going to find out is if we keep living. And our autism and ADHD may be, you know what? There too is dialectical. And for people who don't know what dialectical means, is when two opposing ideas can exist within one. Like our autism and our ADHD has so many similarities, but yet so different.
I feel like that's why it's so hard to get diagnosed, because we have both. They cancel out each other, so it's harder to identify.
And the thing is not consistent, our patterns of behavior.
Yeah.
And you know what? It's just, yeah, it's hard. Yeah, it's hard. It's really, really hard. And also people just assume on the streets because of her skin color, oh, she's brown, she's whatever, she has melanin in her, she's a troublemaker. She is a troublemaker. And it's not the case.
You okay?
Yeah, I'm okay. It's hard. It's really hard.
I feel like enough people don't talk about it. It's something very difficult to talk about.
Yeah, and I think,
but the world would feel so much less lonely if people did talk about it.
Yeah, you know what? If it's okay with you, I think I want to keep this bit in.
Yeah, I don't mind.
Because we got emotional. This is one of the first things I said to you, right? Menas, there's only one rule for this podcast, and is that no matter what, we have to be honest. And if we're not going to be honest, don't say anything.
It isn't easy, and it doesn't get easier. She couldn't say that. You just have to find the strength to keep going.
And we'll do it together. No, you didn't get that part, did you?
Oh, it froze a bit.
And like, I feel like a lot of depression and a lot of anxiety for British Asian women. See how I brought it back? Is because of the environment that we grow up. We are products of our environment. And you know what? Majority of South Asian.
We also have generational trauma as well.
Yeah, that's another thing, generational trauma. Sorry, I'm just so emotional about those. It's hard. And yeah, sorry. And it's let's talk about the generational trauma. Our parents experienced it from their parents, that's the cycle. But at the same time, even though trauma does have an impact on every single individual in some way or other, it might be small, it might be big, it might be out the window.
It actually changes your DNA.
Really?
Yeah, that's how generational trauma happens.
Oh, I know it changes the way that your brain is.
Your brain, yeah.
On an X-ray.
That's why your kids are more likely to have mental health issues.
But I also think, you know what? My parents have physically, emotionally, and verbally abused me for all my life, right? All my life. But the same thing, I do understand my parents could have gone through, I don't know, because they never really talked about their life when they were young, and they didn't really care. But like they've even if they've gone through generational trauma, easier said than done though. But I feel like each parent has the responsibility to break that cycle. And it's like people don't attempt to break the cycle. But either they're brainwashed, which does happen, by the way that they grew up and the culture, and it's instilled in their head that it continues. But I think our generation, let's speak for me and you, we both know that if we have children, or when we have children, it's that we will break the cycle. We'll make active efforts to break the cycle. And I think we have the capability of breaking the cycle because we are open to the fact that it's wrong. We are open to the fact that we have to learn new ways and methods. And we're open to the fact that it's our responsibility when we're parents to give our child a best life. And that include no adverse childhood experiences. So what do you think that parents have the responsibility to break cycles?
I mean, they should. Like with me, when I first went inpatient and I was on home leave, my dad was really upset and he was trying to tell me that I'm only hurting myself to hurt him.
Oh my God.
And I was just, a bit, confused. I'm confused because he's physically abused me in the past. And if he can do that to me, why can't I do that to myself, And then I said it to him and he was like, he does it out of love. And he was trying to tell me that his mum used to hurt him and whatever. And that was her way of showing him love. And that's why he did it to me. Which is just really fucked up. Why would you want to hurt your child? I don't understand how hurting your child can ever be a good thing or seen as a positive thing or be seen as love. Like, what on earth? Genuinely just confused about some South Asian parents and their way of thinking.
And you know what? It's not even some, it's majority. And I feel like this is why we have this is why the depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, OCD, and eating disorders are so common. Because I don't know about you, but like when you were at home, did you feel like you were walking on eggshells?
Yeah, 100%.
And you're walking on eggshells, everything, and if something happens or people's voices like raise, you get startled.
And you become hyper vigilant.
Yeah, hyper vigilant. Or if your brothers or sisters are getting told off, that you're like, oh my god, behave, go study, or something like that. And yeah, or when you eat, or when you eat, they make comments about your body, or how your comments, how you look in dresses, sexualizing children.
I mean, definitely in my family, a lot of family members comment on everyone's weight, and like they will point out if you've gained any weight or if you've lost any weight. They'll make comments about that kind of stuff. And like I think there's a lot of disordered eating within my family, and I think it's to do with some of these comments that some people make. Because it's interesting.
But you know what? They're never going to call it disordered eating. They're going to be calling it dieting, or they're going to call it, because you know what? People don't understand the cause and effect of what they say.
Especially like as an autistic person, I don't know if it's like this for you, but for example, say that someone around me is insecure about having a belly, and say I never had that insecurity before, but after hearing that they have that insecurity, it's suddenly becomes my insecurity.
Is it an autistic thing?
I think so.
Oh my god, I didn't know that. Oh, but you know what? And then people become, and there's where OCD might play a part. Is like then people become really obsessive over their thoughts, which also could cause eating disorders or depression and anxiety. And you know what? All of these like mental health conditions that are common amongst British Asian women are all, in one way or the other, have the links and similar traits, especially if you have complex post-traumatic stress disorder. And I think it's important to know that cultural and social factors may impact the way which conditions present and are experienced, which will be much more better understood if there was more Asian people in the health and social care sector. I feel like because it presents in different ways, like we talked about earlier about skin conditions and stuff like that, or physical illness, there's always pictures of our light-skinned or white counterparts on how it will look on them.
There's a random question, but what ethnicity have majority of your social workers been?
European.
Really?
Is yours black?
All of them. Yeah, I've only ever had one white social worker, and I've had like 15 different social workers.
Man, and you know what? I'm lucky in this sense, but everybody. Okay, I'm just going to say what borough I'm from. I don't really care. Merton Social Services. You know what? I've never had a negative experience. I had one negative experience. Yeah, I had one negative experiences, but majority of the workers are amazing. They're competent. They're great. They're amazing. They are in the job for the right reasons, and I'm so grateful for Merton Social Services for that, because I think I would have found it more difficult if I wasn't from Merton. I find it really, really difficult. And you know what? They taught me so many things, but in such a gentle parenting way. And you know what? Can I be honest with you? They are the best corporate parents I could have asked for.
Oh.
And for people that don't know what a corporate parent is, it'll be somewhere on the screen. It'll be above. Yeah. But I feel like there should be more people in. But like the thing is, wait, have you been in foster care?
Once.
What was
Like,
your
I was younger.
Oh, right. What was your foster care or his ethnicity?
Pakistani.
That's good. They try to put you with, somebody of a similar background. But you know what? That could work too. All my foster carers, right, have been Black, except one couple who are white and brown, like Asian. And you know what? For me, because of my trauma, I don't want to be placed with a South Asian. I don't want to be placed with a family in general. I don't want to be a part of family. I already had a family. Been there, done that, got the t-shirt, it didn't work out. But like, I don't want to be part of family. I don't want to be with someone who has another culture, right? Like a very strong impression.
I feel like culture clash is a massive problem in care as well.
Yeah, I would just want somebody to respect my culture. I don't want another culture to be imposed on me. I want to be around some people like me, but I don't want to be living with South Asian people, because for me, I've gotten much better. Now it's just South Asian men. Like, I find it really, really triggering.
I really struggled when I got put into care because I don't really say please or thank you, because manners in my language don't actually exist. the way that manners are shown within like my culture, my language, is with tone of voice. And so when I've been moving from placement to placement, being around different cultures, different staff, and they're all trying to tell me that I'm being rude and I can't be speaking to them this way, when in their culture it's very important to like use manners and that kind of thing. But for me, like, it's completely different. If I'm
Oh my God.
And especially because I'm autistic as well, I obviously, like, it doesn't come to me naturally because I've been brought up a certain way, and I'm not going to suddenly like going to start thinking, oh, I need to like talk like this, or I need to speak in this way.
You know what? Like, I didn't realize how common that is, because like even in my current placement, people ask me to say please and thank you. Like, sometimes I remember, but again, in South Asian languages, it's the tone of voice. Everything. You know? I'm asking for it, but there's no please and thank you in it. It's just the tone of voice, soft, it's graceful. And also, as British Asian girls, we were often told as a child, can't speak like that. You need to be softly spoken and elegant. Have you ever said, oh, your tone is too rough?
No, but if my tone is a certain way, then it'll be perceived as I'm angry and I'm shouting.
And I'm like, but people don't realize it's the same thing. This has no relevance. But
and like being autistic, we obviously, like, especially when we're emotion dysregulated, we don't recognize tone and we can't control the tone.
Yeah, but you can recognize when somebody else's tone is harsh.
Yeah, but within
I guess that comes from trauma.
Always notice it. Which is within like the South Asia community is so problematic with the way that we're viewed, because we're not doing it deliberately.
Yeah. And it's like girls shouldn't be angry, girls shouldn't be this way. And that has created a lot of anxiety and depression. Like, my brothers can behave that way, but I can't. So let's just say I drop a plate of food, right?
Yeah.
Mad sick deal. But my brothers do it. I was fine, or we just pick it up, clean it. Now, even when I drop water or if something falls on the ground, I get really apologetic. I start like steaming really like profusely. I start steaming profusely, and I start apologizing, and they're like, "It's no big deal."
Yeah.
I'm like, "It's a big deal. I don't want to get hurt," and they're like, "You won't get hurt either." And I'm like, "But I don't want to get hurt. So I'm sorry." Like, it's like, again, that's because there's no barrier. And because you tell a young person that you're looking after, oh, it won't happen here, doesn't mean they're going to be like, okay, that's fine, trauma gone, like, lovely. Like, no. Oh, menace. And you know what? There are a variety of cultural and social factors that may affect the way in which mental health conditions are experienced and addressed in the British Asian community. It may include cultural beliefs and attitudes, like we just talked about, surrounding mental health and illness, stigma and shame around seeking help for mental health concerns, language barriers, a lack of access to cultural sensitive practices and workers who can provide support and guidance for those who are struggling with mental health. So, you know, when you were like in hospital and stuff like that, or when you were at your placements and there was some, you know, trauma that it's like what's it called, cultural trauma. What was some of the effective strategies that you've seen for managing mental health conditions among people of our ethnicity?
I'm not sure, honestly.
Because it doesn't happen that often. That's the answer. It doesn't happen, and it's not seen. Like, people forget that there's a lot of cultural trauma. They focus on the trauma. And again, this is like, you can't view it like that. You can't view autism as behavioral. Or like, it's like that. You can't see it as behavioral. It's like there's certain behaviors that come out, but it's not like that. It's somebody actually can't help what they're doing.
I remember that there was this one time that I decided to smoke and get high, and I was just in my room, and then staff came and knocked on my door and asked me if I wanted to go out and do some birthday shopping and stuff. And she kept like trying to convince me to come out of my room, and I was like convinced that I was going to get into massive trouble or something, and she was just trying to trick me to like come out of my room. And then afterwards I was like thinking about it, and I was like, I don't know why I thought that. It's because that's something my parents would do, and it kind of felt quite ridiculous to me that I thought she was trying to trick me and whatever, when that is not what she was trying to do. She had no idea that I was high, and yeah, and that's just something that my parents did that was quite traumatic for me.
Yeah, I had that experience with my parents as well. Like, one of the massive ones that I remember is when it was before school, and my parents, their angers are all the way up, and we have an extension sort of thing as well. So like, outside, if you look outside my bedroom, it's an extension, because my parents and my rooms are right next to each other. Is that they can climb on the extension. So my father was there banging on my window on top of the extension, climbing, banging on my window. My mother's banging on my door. I had this lock, this dainty little lock, right? The noise is getting too loud. I can't bear it. And they said a dog is going to come through your window. I was, before that, now I'm not, but like before, I was like deadly scared of dogs, as if they were deadly. I was scared, so scared.
Yeah.
And they came, and I got like physically assaulted multiple times, and like pulled my hair, strangled, and all that sort of stuff. They manipulate you. And you know what? When you're young, your parents are supposed to be doing things in your best interest. They're supposed to care for you, look after you, and not hurt you. And they are one of the biggest influences in our lives. And you know what? They fail to realize their responsibility. It's, yeah. And they fail to realize their responsibility. And there's things like that. If I told my therapist was really good, actually. If I told like any other therapist, they'll be like, oh, it's okay. Oh, it's a one-off experience. My therapist, Kelly, she's amazing. Sorry. Sidetrack. She's really amazing though. Sorry, I don't know why I keep daydreaming. It's like, yeah, she's amazing. But like, if I went to like, I don't know, somebody else, you know what, her whole team. I mean, like somebody outside of her team, They're probably going to make me feel invalidated, make me feel shit, make me feel shame and all that sort of stuff. And I'm like, no. It's like either you need some cultural training or you need to get some ethnic people to work with us as well.
Yeah.
But I think some of the effective strategies for managing mental health conditions among people like us is a combination. It has to be a combination of therapy, medication, and lifestyle changes. And lifestyle changes, like we both are doing all three. For example, you don't live at home, and I don't live at home. I'm in care. We both are going through intensive therapy, and we go twice a week. You go twice a week, don't you?
I don't go twice a week because I live very far away, but I have 2 sessions a week.
Yeah. And 2 sessions, I have 2 sessions, one school session, one therapy session. And we're both on medication. What medication are you on?
Quetiapine.
Is that it? Sorry.
Yeah.
Wait, what sort of PRN do you have?
I don't currently have any PRN.
Oh God.
What's your PRN?
I got promethazine.
Promethazine used to be my PRN, but it just stopped working.
Yeah, you're supposed to take breaks from it.
Yeah.
See, our ADHD is ADHDing again. It's like, and hopefully, with a bit of time, hopefully, this is what everybody keeps telling us. Let's hope they're right. Hopefully, that our lifestyle changes, our combination of therapy and medication, us working on self-harm and suicidal urges and behavior could help us get better. And I feel like if there was like an ethnic group, like a, I don't know, a support group or community or even a group chat, that's like, I would be messaging on that group chat daily. Like we need something like that. I feel like that's what we're missing. I think Slam should start one. Yeah.
Start what? A group chat?
Not a group chat, but like an ethnic.
A group, yeah. You know how they have like autism groups? They should have like an ethnic group.
Yeah. Hi, Slam. Hey, are you like? It's going to be on the staff that are going to run the group. It's going to be on a voluntary basis. I don't think the NHS is going to fund that.
Have you ever been in an autism group?
If you call it an admission to a psychiatric ward in autism group, yeah.
No. I was supposed to be put into one before I moved out of South London. I'm so sad that I missed that opportunity.
See, this is like we addressed earlier in the video. This should not be the case. There should be autism support groups all over the country. The care and standards should be exactly the same everywhere you go. And the standard, not bare minimum shit, high standards. Because any care involving human beings, like I said previously, should be of a high standard of care. Yeah. I'm getting a bit hyper. My medication is going to run out in an hour and 4 minutes. That's why. And I feel like to better tailor mental health conditions amongst people like us, I think it's important to understand the unique cultural and social factors that will impact our health and stuff. Because this could involve people conducting research, engaging with Asian women to learn about their experiences, and working with mental health professionals who are knowledgeable about cultural nuances to this community. Is that too much to ask? No. It's also important to provide cultural sensitive and accessible mental health practices and awareness so we can finally reduce the stigma around mental health in the British Asian community and can help encourage other girls and boys like us to seek help when they need it. And yeah, so to end off, our final question is, what advice would you give to anyone or a British Asian woman who's struggling with her mental health or their mental health, but doesn't know where to turn for help?
Your GP.
Yeah. If you're struggling with mental health and don't know where to go, there are many resources available, from crisis lines. We will put the crisis line in we'll put the crisis line somewhere and we'll let you know. But like crisis lines, and you can start by going to a doctor or a mental health professional who can provide you with guidance and support.
And if you can't do that, do it through school.
Oh, you can do it through school. Oh yeah, sorry. You can do it through schools, and you can reach out to support groups or community organizations. There's lots of them. I know there's lots in Merton. I'm from Merton, so I don't know anything outside of Merton really. But I'm sure Haringey has some.
What, support groups?
Yeah.
No.
Okay, no, we're not. So if you're struggling with your mental health and don't know where to turn for help, there are many resources available to you. You can start by talking to your doctor or a mental health professional who can provide you with the guidance and support that you need. And they might, you can also do self-referrals and stuff like that, or they might give you support groups or community organizations that specialize in mental health for all sorts of people, and I'm sure there's some for British Asian women as well. So you can contact a crisis line or text a crisis line for immediate support. Remember that it's okay to ask for help, and that there's a lot of resources available to support you, and there's people that are willing to help you and understand and be there for you. And I think it's important for you to take anybody who wants to wants to have support for their mental health to actually go and do it. Easier said than done, and it's going to be challenging, but you'll be really, really, really happy. And if you're over 16, they can keep your file confidential. They don't have to share unless it's safeguarding concerns, obviously. I saw the way that you looked at me and I knew I had to say it. Yeah. So, yeah. And thank you for tuning in this week's episode of My Trauma's Chronic, but I'm Iconic. We hope you enjoyed listening as much as we enjoyed recording it. If you have any feedbacks or suggestions, please let us know. We'd love to hear from you. You can reach us on Twitter, Instagram, TikTok, and hopefully Spotify. We get this sorted this week. And don't forget to subscribe to our show on your favorite podcast apps so you can never miss an episode again. It's like, how can you miss the episode if we do this? Anyway, thank you again for listening, and we'll see you next week.